now we have the opportunity to talk to Mariana Vituro, who is an amazing complement to the speakers that we've had today. Let me introduce her right now, and then we'll get to hear what she has to say. Ms. Vituro has been organizing low-wage workers in California and nationally for more than 20 years. She's a dedicated labor and social justice leader and strategist with deep expertise in the care sector and future of work policy solutions. For the past 8 years, as Deputy Director of the National Domestic Workers Alliance, Mariana has brought a clear vision to achieving worker voice for the most vulnerable and fastest growing workforces in our economy today. Ms. Vituro holds a dual bachelor's degree from the University of Michigan in anthropology and Latin American Caribbean studies. Welcome, Mariana.
Thank you. Thank you so much for having me. And let me share my screen. Yeah. So good morning and almost afternoon. I'm Mariana Vituro. I'm Deputy Director of the National Domestic Workers Alliance. And I see that bio is a bit outdated. I am in my been with the organization for a little over 11 years. Thank you so much for inviting the National Domestic Workers Alliance to take part of this conference. And I'm honored to participate in this important conversation on precarious work and share the experience of domestic workers and our learnings from working on making these essential jobs, good jobs with health and economic equity and security. This is a very timely conversation as we are living in the midst of a once in a generation opportunity for care for women of color and for workers. So let me start by sharing a little bit about what I will be doing today. I will first take a moment to ground us in the history of this work and the characteristics of the domestic work sector. As part of this overview, I will share some of the unique challenges of the sector, which more and more workers in other industries are finding themselves in, and which requires us to be creative in our thinking on what it will take to make these jobs good, safe, and quality jobs. And our strategies and how we transform this sector. And finally, share the opportunities we see to create a different care infrastructure and workforce for the 21st century that would uphold economic security and equity.
Hi, Mariana. I'm sorry to interrupt. Can you just be careful of hitting your microphone when you're changing your slides and moving your papers? It's giving us just a little bit of feedback. Thank you.
I wonder if I should not use, I'm using my headset, so I'm surprised.
Yeah, something about the placement of the microphone to your papers when you move them on the desk, it's kind of jumping to be pretty loud on our side. So I don't know if, I'm not sure where the audio is set, but.
Okay,
I'm sorry to interrupt you for that.
No, it's all good. It's all good. It's just that, okay.
Okay, thank you.
Sure, of course. Sorry about that. So when we talk about domestic work, we are talking about 3 industries: house cleaning, nannying or childcare, and home care. Those workers who provide care for our families and our homes. Domestic workers are mostly women, disproportionately women of color and immigrants, both undocumented and undocumented. Domestic workers do the work that makes all other work possible. Their work is the invisible scaffolding in our economy and society, allowing mothers to return to the workforce, our elderly to age in place, and easing the pressure of what we call the sandwich generation, who find themselves caring for their children and their parents at the same time. And yet they exist in the margins of the economy, in the shadows for generations. The invisible workforce is unseen behind the closed doors of private residences and is largely unprotected in this country. One of the primary reasons that this work is undervalued is because the work is racialized and gendered. It is seen as less than real work because of its association with women, and in particular, women of color, and enslaved Black women who were the first domestic workers in this country. In fact, domestic work was one of the 2 professions intentionally excluded from workplace protections and rights during the New Deal, like the Fair Labor Standards Act and the National Labor Relations Act, to appease racist lawmakers and exclude Black workers from basic employment rights and protections and the right to organize. We are still fighting against some of these exclusions to this very day. Another reason is the unique characteristic of domestic work. The work is largely informal, cash-based, where workers are working behind closed doors, isolated in private households. The employment relationship is also one-to-one, meaning one worker to one employer, or in most house cleaning arrangements and some home care and nannying, one worker to multiple employers. So there's no definitive number of domestic workers because there is no central list or registration. It's so much of the work is in the informal gray market. But we do believe there's close to 2.5 million workers that work in unmarked homes, spread out and disaggregated all over the country, and working for millions of employers who may not consider themselves employers. So you could be walking down the street and not know which home is also a workplace. And it is still very much like the Wild West, where there are little guidelines or standards in the industry. So both the history and the structures of the industry pose real challenges to raising standards, improving conditions for workers, and ensuring that they are safe, healthy, and work in dignity. As a result, we have millions of workers with little to no job security, safety net, or benefits. Most workers lack any form of work agreement or contract and lack basic protections to ensure their health and safety, and or that they aren't harassed or discriminated against. Despite working incredibly hard, this work is still poverty wage work, and where occurrences of wage theft, either because of an employer didn't pay wages or overtime that was owed, is very prevalent. This is why we consider domestic workers to be kind of the original gig workers. We see their experiences and conditions as a canary in the coal mine for what the job standards of the future, or more and more common in the present, could look like. The pandemic only exacerbated these conditions for workers. These headlines are illustrative of the impact of the pandemic on domestic workers. As you can see, from one day to the next, most domestic workers lost their jobs and their income with no safety net and or benefits. As soon as the pandemic hit, we deployed weekly surveys to an average of 1,200 workers each week, incidentally creating one of the most unique pandemic data sets on informal workers in the country. Through our Facebook chat bot, we wanted to maintain a real-time view on the conditions workers were experiencing. And what we learned quickly, as soon as the pandemic hit, was that the majority of domestic workers became either unemployed or underemployed, and were in crisis and unable to pay their rent or mortgage or put food on the table for their children and families. For those who did continue to work, they were fearful for their own health and the health of those they cared for. Domestic work couldn't transition to being remote work. They were not provided the necessary PPE. They had to continue to take public transportation to get to work, and their workplaces lacked any safety protection protocols or guidelines. So I will say this sector really matters because of its rate of growth. These will be the jobs of the future. In fact, with our growing aging population, domestic work, in particular home care, is among the fastest growing occupation in the country. This work is a huge part of the future. It is work primarily being done by women and women of color. So we have both the opportunity and the responsibility to make them good quality jobs, which is why at the National Domestic Workers Alliance, we have given ourselves a North Star: make every domestic work job a good job with benefits by the year 2030. But in order to get there, we must solve for two key challenges. First, the structural racial exclusion of women of color in our democracy and economy. And second, the practical challenges that come with trying to raise standards and get to fair work in this extremely disaggregated and invisible industry. So as we approach transforming domestic work jobs into good jobs, we have found that many of the conventional strategies or interventions don't quite apply for a number of reasons. So first, where a collective bargaining agreement would establish protections, standards, pay, and benefits, domestic workers are prohibited legally from forming a union, as the National Labor Relations Act explicitly excludes them. But there are also pragmatic barriers, given the level of disaggregation, in that each worker has a different employer or employers. Formalizing the informal market would also require immigration reform. Otherwise, formalization can create a bifurcated system, making conditions even more challenging for those undocumented workers. So there are real unintended consequences of stratifying an already stratified workforce. There are also many different kinds of work arrangements in domestic work. Some workers are W-2, some are 1099, some are off the books in the gray market. In some ways, some of the current legal frameworks and protections are inadequate for a workforce like the domestic workforce. And we believe that every job, regardless of arrangement, should have certain protections, rights, and access to benefits. These jobs are also here to stay. So domestic work cannot be outsourced. This means that the interventions that seek to upskill workers to get them out of the field isn't a solution. Not to mention that these jobs are already high-skilled jobs. So instead of upskilling, what we need to do is upgrade the jobs with higher wages and standards. And lastly, related to the last example, training rarely results in higher wages for domestic workers. Training does ensure workers can maintain safe and healthy practices on the job. So for example, we provide training to home care workers about how to properly lift their patient in order to not hurt their backs or themselves. We also provide green cleaning training to house cleaners to minimize their exposure to toxins and chemicals that are prevalent in cleaning supplies. But unfortunately, training alone doesn't improve job quality because the job as a whole is undervalued. Training or workforce development needs to be coupled with policy interventions that, for example, establish a certain wage scale with certain training. So for all these reasons, we have needed to innovate and be creative with our strategies and interventions. Most importantly, we have always placed organizing domestic workers at the center of all of our strategies. It isn't just a value or a philosophical stance, but it also produces the best ideas and solutions. Domestic workers are the real experts of the industry and whose leadership should shape the future of the domestic work industry. We also work to develop and win policy change that impact domestic work. Over the past 12 years, we have won 13 domestic worker Bill of Rights in 10 states and 3 cities. These bills have first and foremost struck the historical exclusions of this workforce from basic rights and protections and extended them to domestic workers. This including health and safety protections, the right to minimum wage and overtime, protections against discrimination and sexual harassment. They have also set specific industry standards and created mechanisms for enforcement and worker voice. For example, in Seattle, our bill established a domestic worker standards board that brings domestic workers and employers together to discuss and establish future interventions, policy recommendations, and programs to improve the domestic work industry and shape the future of it. These bills have, more importantly, taken these workers sort of out of the shadows and made visible an invisible workforce. We have also leveraged technology and innovations to organize workers, tapping into domestic worker digital networks and providing domestic workers products, services, resources that they need to improve their lives and work. One of those products was an emotional and on-demand emotional and practical coaching services that workers could access on demand via text messages, including WhatsApp and Facebook messengers, while on the job, while on their way from a job. These digital tools and community have also helped us maintain a pulse on what our workers experience to inform those policy responses and help us to make a strong case for domestic work protections and relief with key stakeholders and the wider public. Our Innovations Lab has also built products and led initiatives to influence employers to provide fair or higher standards for domestic workers above the floor that is set legislatively or by policy. We built a benefits platform where employers could voluntarily contribute to their workers' benefits to ensure domestic workers are able to take a day off if they are sick or need to take care of a sick family member and not lose their income for the day. And lastly, the undervaluing of the work is largely related to the social norms and perception of domestic work. This is why it is so important to shape culture and narratives that counter the perception that domestic work isn't real work. We lift up domestic workers as central protagonists in our society and in their lives, and tap into the storytelling of popular culture to move audiences and shift dominant narratives about domestic work and care. It has been important for us that these sort of multiple strategies work together and complement each other. For example, organizing culture change and innovations have supported workers realizing the newly won rights and protections that we've been able to accomplish through the policy work. Now we recognize that this is the biggest sort of opportunity to bring attention to the impossible choices for people working in the low-wage economy, to seize the current visibility of essential workers, and to reimagine an economy that could help protect them through moments of crisis like this one. The pandemic disrupted everything about the way we live, work, and care. And in order to translate the disruption into lasting change, we believe we have to cement the shifts in public awareness to the pre-existing inequities that made us vulnerable and actually win the boldest policy solutions possible. This is why we reintroduced a national legislation for domestic workers, the National Domestic Workers Bill of Rights. This bill is built on the precedent and learnings from our state and city bills and puts forward a new framework for rights for this workforce that goes further than fixing exclusions, but seeks to codify new mechanisms and infrastructure for establishing future standards and programs on a national level. We also launched the Care Can't Wait Coalition and campaign to build a comprehensive care infrastructure in the conversations about economic recovery that includes universal access to childcare, paid leave, home and community-based services, and ensures that all care jobs have fair wages and benefits. These two policy vehicles are essential parts of the 21st century care infrastructure that makes care affordable and accessible, expanding the safety net for everyone, while addressing infrastructure and regulations to make these care jobs good jobs. And in order to win these big investments in the care economy and the care workforce, we need to expand the realm of what is possible by shifting and expanding the narrative about care and care work. We need to be chipping away at the harmful narratives and false choices we have been fed for generations towards positive narratives that situate care is a public good, care workers as essential, and care is necessary infrastructure that will lead to an equitable recovery and sustainable economy. And we believe that we are on the precipice of transformational change. The pandemic created a moment around care and care infrastructure and care jobs that is long overdue. There's an opportunity to win big structural changes that are needed in the lives of not only our workforce, but the future of all workers. Thank you. So thank you very much. And I'm excited to hear your comments and questions.
Great. Thank you so much, Mariana. Okay. It's so comprehensive in terms of understanding the complexity of issues that got us where we are today with domestic workers, and then the types of things that need to be resolved or changed or transformed in order to make progress on making domestic work good work. You have quite an ambitious agenda, and this is very important for us to consider because care isn't going to go away. We, as your last slide indicated, it's essential work. And one of the problems that I see with domestic workers and domestic work in general is who pays for it? And, what's the affordability of care? And we have forced it into a low-paying job because everyday people pay for it. So that's not a deal, breaker here, but one of the ways to attack this problem is, who pays for it, and how much can be paid for it. And if we can lift domestic workers out of the lowest wage rates to a higher level, that seems to be, a critical way to try to address this problem. If we pay people more, they can afford more in terms of their support. They can pay into the account or the reserve that allows them to take a day off without losing their pay, and so on. All of the things you just talked about. So, and it's complex. the many things that you have to undo or redo or change really are difficult to think about. But let me present a question that is brought by one of our attendees. Mallory Johnson asks, do you see rebalancing efforts in long-term services and supports as a positive change for direct care workers? Will direct care workers have better working conditions in homes rather than nursing facilities, as payment systems offer more options to age in place?
So one is, I'll address this question and also comment on your kind of framing remarks that, and so I think the funding, and I do think that we're in a moment where we can really make care, and in particular, like the need and the demand for long-term care services, sort of a social responsibility. And over time, it's become something that individual families have to figure out, not only the plan, but also the affordability. And in some ways, we do need a higher level of investment into the kind of the care system to be able to increase the access to services for working families, while at the same time raising wages and benefits for those who are providing the care. And I do think that in order for, like, the question on the direct care workforce, many of our workers kind of actually work in both there's a lot of transition between working in facilities and working for home. I think our workers find a lot of pride and find a lot of fulfillment in a lot of care, in caring for their elderly or people with disabilities. And at the same time, a lot of the transition and turnover rate is because the work is extremely difficult and is paid in most parts of the country minimum wage. And so, and during the pandemic, what we found is there was very little shift in home care agencies in terms of their protocols, in terms of their guidelines, in terms of like scheduling, providing PPE to workers, despite the COVID-19 pandemic. And these workers not only fearful for their own exposure, but very much fearful of exposing their the workers that they were the patients and consumers that they were caring for. I do think that as we've seen from a lot of sort of studies, I do think that there is a transition. There's a transition and a benefit to people aging in place and being able to stay within their communities and their homes. And we want there to be sort of kind of all options. And we want to make sure that the direct care workforce is able to, regardless of where they work, are able to have dignified jobs that have higher pay, that have access to benefits, paid time off, that they have the adequate training to ensure their health and safety on the job. And so I do think it's not a question about whether it's nursing facilities or home environments. It's more about how can the workforce be able to get the kind of professional training, the support, and the quality standards to be able to stay in the job and have the dignity and respect that they have in the job. So I think that is, and as I said, I think that's sort of what this push for the investment in home and community-based services is really about. It's about ensuring that we start adequately investing and supporting the care system that really supports the sort of the entire economy, and really kind of shifting the way that we think about infrastructure and what we all need to be able to sort of, thrive.
Great. As we can all see, it's very complex and interrelated, and we're struggling to find a path through. Another attendee asks, would like to hear more about the types of changes included in the current National Domestic Workers' Rights Bill. Have they been able to modify OSHA exclusion in any states?
This is a great question. So on the health and safety protections, it's been really challenging to win inclusion into OSHA. We had a bill 2 years ago trying to strike the exclusion of domestic work in Cal OSHA, and was unsuccessful the first time around. And then this last year, we reintroduced the bill and instead of winning inclusion to Cal OSHA, we actually were able to establish a task force that's led by Cal OSHA that brings together workers and employers to, one, establish guidelines and standards for domestic workers, recognizing the unique characteristic that the workplace is someone's private home. And so setting up a set of guidelines around ensuring kind of like health and safety protections, and also kind of protocols and practices for the domestic workforce, right? And there's some that are about all three industries, but some that are specific, right? With house cleaning really being around exposure to cleaning toxins and chemicals, as well as sort of some repetitive injuries with cleaning, or we've had cases of workers having to stand on precarious kind of furniture to be able to clean at the top, on the top shelf, et cetera, versus home care workers, which is really sort of related to both contact with a lot of like sort of bodily fluids, and as well as like lifting, right? So we have like starting to set up sort of like a framework of what are the kind of practices and protocols to ensure health and safety for the domestic workforce. And so part of it is coming up with some guidelines. And the second is kind of looking at future policy recommendation, including the inclusion into Cal OSHA. We have been successful in one state to win inclusion into occupational health and safety, which is in last year in the state of Virginia. We were able to win inclusion into safe, and as part of the implementation and regulatory process, we had a task force, the multi-stakeholder task force, to sort of go into some of the kind of unique kind of guidelines and standards that would meet the needs of the domestic workforce, while like the consideration of the kind of the private home. And the National Bill of Rights includes sort of a set of provisions that are striking the kind of the last remaining exclusions from federal employment law, including like live-in workers are a segment of the domestic workers that that is not protected, that does not have minimum wage and overtime protection, for example. The second set, as I said, are some specific kind of new infrastructure and mechanisms for enforcement, including sort of community grants to worker centers or other community groups on education and outreach to both employers and workers around their rights, as well as setting up sort of a national standards board that's modeled after Seattle, which would bring together domestic employers and workers to discuss and develop sort of future policy or programs or standards for this industry that would be kind of overseen by the Department of Labor. And there's also provisions in the bill that are about studies around how to extend benefits to domestic workers, given both affordability as well as sort of the one-to-one employer-worker relationship, or the workers that have multiple employers. So looking at studies that would look at portability, et cetera. There's also a provision around having a template sort of agreement or contract that would be helpful in not only workers having clarity on the conditions and the terms of their employment, but also for employers, giving them some guideline, because many employers, one, don't identify as employers, but don't know how to kind of navigate or ensure that they're in compliance of the law.
Great. So Victor Rubin asks, what are the prospects for or barriers to domestic workers organizing into co-ops or other worker-owned or collective arrangements to get leverage for better conditions and pay? Do you see anything on the horizon?
Yeah, that's a really great question. And in our alliance, we have a number of affiliates and community organizations. We have a number of affiliates that have incubated worker co-ops in nannying, house cleaning, and home care. And exactly as you implied in your question, it is a really important way to set not just the floor, which is what legislation, but actually what fair work could look like. And in fact, in California, our affiliate Filipino Workers Center, who's in Los Angeles, is actually looking at, they have a home care co-op, and they're looking at scaling up their co-op to be statewide, to be able to be almost like potentially almost like a home care authority or registry that's complement to what we see on the public sector, like the IHSS, the in-home support services, but to be able to scale up this co-op model to be able to set a certain fair wage and standards, and be able to sort of facilitate families trying to, find a care worker or a caregiver. And so I think this is actually just, there's just starting to kind of like figure out that scaling. Because I think that's been one of the biggest questions and challenges for our co-ops is, most of them have stayed fairly small, primarily because of the lacking sort of expertise in kind of marketing and promotion, but the part of it is how many jobs they're able to access for their co-op members. And haven't always seen sort of growth over time. So I think the California is sort of an interesting model for us to look at and learn from and potentially replicate on how we get the co-ops to have a certain penetration in the market and a certain share of the market to be able to actually influence standards beyond the co-op itself, but if that can actually set to be a norm across the industry.
So I have time for one more question, and this is a different kind of question, which I'm sure you'll relate to. This is from Patty Katz, who says, it seems that this is also a gender equity issue. Women who make up the majority of the workforce have historically received lower wages. Gig work has become a more visible issue now, and there's a greater presence of men in that work group. What are your thoughts about that? Do you think it might, shift public opinion and societal support for domestic workers if some of the equity issues get resolved, or is it kind of a side issue?
No, absolutely. I mean, I think our assessment is one of the main primary reasons domestic work is undervalued, and for a long time, I think not considered real work, either if you look at legally as well as culturally, is because it's deemed sort of reproductive labor, right? Labor that is done by women and that is considered to be unpaid and so I do think that is actually some of the roots to the conditions of domestic workers today. I do think that with the work around care and the work around care investment, I think there's a real opportunity for women workers in women. And a lot of this has been like having sort of a shared agenda around what is the kind of the support and needs that women in the workforce have, and how to ensure that the care workers that are supporting them have dignified jobs. So there's like a shared agenda around all the sort of, I would say, sort of domestic work that can be I think is a part of a broader women's agenda, as it impacts all of us as we try to balance work and care for our children or our parents or our grandparents, as we fight for paid leave, as we fight for paid sick days, right? So I think there is a sort of, in this moment, an opportunity for us to really put the care agenda and domestic work agenda at the center of a broader sort of women's agenda on what we want and what we think a caring economy should look like, and what does that mean for women and their families and their communities. So I think that's totally right.
Okay, thank you so much, Mariana. You've talked about a lot of different directions that we could go, and the need that is very dramatic and will grow in the future. And what a nice compliment to the other presentations that we've had today, where it's, really down to earth in terms of precarious work among these individual kinds of workers.